Dr. Mark Dailey here. Today we're going to continue our discussion on subclinical gluten sensitivities. On our last video we described the inflammatory process that gluten causes. Today we're going to talk about its effect on the digestive and hormonal system. Now keep in mind, good health requires proper digestion and absorption. Digestion is the mechanical and chemical breakdown of the foods that we eat. As food is digested, it needs to be absorbed. Absorption is the process that brings the nutrients from our gastrointestinal tract to the rest of our body. Digestion is initiated when we chew food and begin to break it down with digestive enzymes. Food then enters the stomach, where further breakdown occurs from the presence of stomach acid called hydrochloric acid and pepsin, which together begin to break down protein. From the stomach, the products of digestion enter the small intestines. The small intestines, called small because it's smaller in diameter than the large intestines, however, it is in fact longer and in many ways more crucial to our health than the large intestines. The lining of the small intestines consists of villi, which are finger-like projections that stick out from the wall of the intestine into the lumen, or the center of the tube, if you will. These villi are between 1/2 and 1 1/2 millimeters long. They're really just barely visible to the human eye. On the ends of the villi are microvilli, sometimes referred to as the brush border. These two adaptations, villi and microvilli, increase the surface absorption area of the small intestines up to 1,000-fold. It's estimated that the entire absorptive area of the small intestines is roughly the size of a basketball court. This total area for absorption can be compromised by any condition that irritates the lining of the small intestines. In gluten intolerance, there is a destruction of the villi referred to as villus atrophy. This leads to poor digestive function and affects many vital structures on the intestinal wall. Poor intestinal function caused by improper digestion of food is referred to as maldigestion, or literally bad digestion. Inadequate absorption of the nutrients is referred to as malabsorption. The inability to get the vital nutrients in your body and delivered ultimately to the cells. One system significantly impacted by maldigestion and malabsorption in the small intestines is the hormonal system. I've treated gluten intolerant patients whose indigestion problems were misdiagnosed as heartburn, irritable bowel syndrome, and who suffer from chronic gas and bloating. Subclinical gluten intolerance creates a significant stress on the immune system and can lead to a compromised immune system. The mechanism of action occurs in several different ways. There are specialized immune cells that line the small intestine called immunocytes. These immune cells produce secretory IgA, which is a critical component of the thin, healthy mucus that makes up your first line of immune defense in the gastrointestinal system. The inflammatory response produced in individuals that are gluten sensitive destroys a certain percentage of these cells, and this in turn can lower your immune defense, thereby opening the doors to intestinal infections. Through this mechanism, parasites, bacteria, viruses, and yeast or fungal organisms can more easily infect someone who is gluten intolerant and suffering from a weakened first-line immune defense. This lowered immune defense is referred to as depressed secretory IgA, and I see that in the bulk of my patients, and it's reflected in their lab results. And it can result in a lot of other food reactions, and we'll cover that more in another another portion of this series. This is because secretory IgA also helps the body process food antigens. Now, food antigens can create significant health problems. An antigen is a marker that is recognized by our immune system as okay or not okay. Antigens mark substances as foreign to the human body. The recognition of what is an okay antigen and what is not okay antigen allows our immune system to attack and destroy harmful substances. So, for example, when you have a viral infection like the common cold, the virus that infect us have antigen markers on their outer surface, and our immune system recognizes these antigens and then makes antibodies to destroy the virus. Food is also foreign to the body and therefore has antigens. Typically, we don't react to food antigens. However, in some people, food reactions do occur because of an inappropriate response of the immune system to antigens in the food. And this will be explained again more so as we get deeper into this series. But other people may be sensitive to pollen antigens or mold antigens and have reactions to these individual or particular substances. The overall weakening or depression of our first-line immune system, called secretory IgA, makes us more susceptible to antigens of all sorts and can make a person highly reactive to food antigens who might not otherwise have this problem. And that kind of opens the door for a discussion on food sensitivities that we'll work up to. But this is another link between gastrointestinal stress and the immune system. It also is the first step of developing, as I mentioned, food sensitivities. And that's where we'll pick up on our next video. Thanks for your time and attention.